नमस्कार। आज हम बात करने वाले हैं गुणों के बारे में। वी विल गोइंग टू टॉक अबाउट गुना इन अष्टांग हृदय। अष्टांग हृदय में सूत्रस्थान में गुणों के बारे में कल हमने yesterday we had talk about the guna of tridosha. Today we will going to talk about the guna. There will be electricity problem here. No lights. Still we continue. Look, when we're talking about the guna, there are various guna explained in Sanhita, especially 20 sharir guna is explained, in which kuru, manda, hima, snigdha, shlashna, sandra, mrudu, siraha, gunaha sasushma vimshati saviparyaha. अर्थात every dravya had its quality and it has its characteristics. When we talk about the guna of dravya of any medicine, we're going to give to patient having a quality of guru guna, laghu guna, manda guna, tikshna, sheeta, ushna, snigdha, ruksha, slakshna, khara, sandra, drava, mrudu, sthira, saram, sukshmam, vishadam, pichilam. So these are the 20 gunas explained in Asthanghruday Sangraha. While reading the Grantha, we got to know that Oja, the immunity, the Oja also has a quality and guna of 10 guna, and exactly opposite of Oja, Madhya or Visha has a 10 guna. The Oja, quality of Oja and quality of milk has the same quality, has the same guna. So whenever there is a Oja Shaya, Rasa Shaya, Acharya always say to drink a milk. By drinking a milk, the Ojo Ruddhi always beneficial. In Charak Saita also, Charaka has talking about the 6 guna, about the divya jala, which is coming from the rain. This divya jala has a quality of 6 qualities. So when we talk about this 20 gurvadi guna, so how we going to use this guna in clinical aspects for treating the patient? First of all, one should understand dravya is only a character, but guna is the property. Without guna, dravya is has no use. So while treating any patient, we need to understand. We need to understand the guna of a roga, what characteristics has been increased in that roga, and according to that we need to use the chikitsatmak dravya which having a quality of a as per respective the guna. So let's see this guna. So when we're talking about the dravya, so Acharya Charak has said, Yatra ashritaha karma gunaha karanam samvayi yat dravyam. Every dravya is contained with karma and guna. Every dravya is contained with karma and guna for responsible a positive characteristics samvayi karanam work. हर एक द्रव्य को एक कर्म और एक गुण से बंधा हुआ है. Every dravya is adhere to karma and guna, and it is responsible to do according to his karma and guna to do samavayi karanam work. And that samavayatvam is called the dravyam. So this karma and guna cannot be separated from the dravya, from that dravya. We cannot some sweet dravya, we cannot remove the madhuratva. If you take a black pepper, we cannot remove the tikshnatva from that black pepper. Has its samavai sambandha with respect to each other. Every guna and karma has its samavai samavatva, like a pitta, like a kapha, like a vata. Vata has a rukshatva and shulatva. Ruksha and shula, these two guna dharma. One is the karma to creating a pain, and one is the rukshatva, dryness on the skin, dryness in the ashaya, is its quality of vata. When we're talking about the pitta, so the pitta has a ushnatva, tikshnatva, and pitta has a work of pachanam, varna prasadam. This kind of work also is responsible in we talking about the pitta. So the guna is the samavayi to nichest karanam gunaha. What we call samavayi to nichest karanam gunaha. It means it is placed with dravya, and with the help of dravya it is responsible to do the same quantity of work which the guna characteristic that dravya had. द्रव्य के आश्रय से रहने वाला और द्रव्य के साथ समवायी संबंध रखने वाला रिजेंबल्स कैरेक्टरिस्टिक्स वर्क, और द्रव्य से अलग नहीं होने वाला, द्रव्य के साथ रहने वाला, द्रव्य के साथ रिजेंबल्स कैरेक्टरिस्टिक्स वर्क करने वाला, and it cannot be separated from dravya, that is guna. Like pitta has a ushna and tikshna guna, And that ushna and tikshna guna has a samavayi sambandha with pitta. When you're talking about the pitta is ushna and tikshna. When you're talking about pitta is ushna and tikshna. We cannot separate this ushna and tikshnatva from pitta. And ushna and tikshnatva will do the work of pachana, deepana, varna prasadana of pitta dosha. So it resembles with pitta dosha. It work according to the karma of a pitta dosha. It cannot be separated from the pitta dosha, that is guna. Are you getting? समझ में आ रहा है? गुणों का कैरेक्टरिस्टिक्स आपको समझ में आ रहा है? Hello, are you understanding what are the gunas characteristics? Yes. After that they have separated the guna in various stages, like atma guna means सार्थक गुरुवार्दयो बुद्धि प्रयत्नांत परादया गुणाः प्रोक्ताः. गुणों के जो वर्णन है, सार्थ गुना, आत्मगुना, गुरुवादि गुना एंड परादि गुना. These are the guna as explained in Charak Sahita, Sutrasthan. And what are the guna is explained in Asthanghruday, that is Tridoshatmak guna and Guruvadi guna. Okay. So when we're talking about the guna, we will explain every part of the guna. So Atma guna, Atma guna. They have given buddhi, sukha dukha, buddhi, sukha ichha, dvesha prayatna. Buddhi, sukha, ichha, dvesha prayatna. So what are these Atma guna? What are these Atma guna? So this Atma guna are the communal work in between the motor and sensory to the target organ. Now, what is Atma guna? मैं जो चीज देख रहा हूं, what I am understanding by looking my eyes, by looking my इंद्रिया, मैं जो नाक से जो सांस ले रहा हूं, जो गंध ले रहा हूं, ये जो गंध है वो नाक से मेरे मेडुला ऑब्लोंगेटा में, मेडुला से ब्रेन तक जाता है और वहां पे जो एनालाइजिंग होता है, एनालाइजिंग होने के बाद जो सेंसरी नर्व से, मोटर नर्व से मेरे अगेन जो रिफ्लेक्सेस आते हैं, मैं जो जबान से जो what I am taking the taste from my taste buds, from taste bud to the medulla to the sensory part of the associate sensory part, and again there is a from sensory part to the motor part, again the signal transported to the medulla to the my taste buds, that yes, this is the madhura rasa, this is the amla rasa, this is the various types of rasa. Is understanding of that rasa is occurring the path, target organ, indriya, karmendriya, karmendriya to the medulla, medulla to the emotional center, amygdala, hypothalamus, hippocampus. These are the emotional centers. From emotional center, they analyze the sensation. They analyze the sparsha, rupa, rasa, gandha. Okay, they analyze this jnanendriya, karmendriya, sarthaguna, and after analyzing this gandha, they send the sensation to the sensory and associate sensory part. They decide, yes, it is that part of the indriya, then send the motor reflexes. A motor reflexes again to the emotional center, amygdala, hippocampus, and from that to the medulla, medulla to the indriya, medulla to the indriya. So what exactly, what exactly these things happens? What exactly these things happens? First, when we take the taste, there is a icha. There is a icha of understanding that taste. There is a prayatna of understanding that taste. And then this icha and this prayatna has a vidyan, that vidyan taking that icha and prayatna to the medulla. Medulla again, with the help of a guna of a prayatna, taking that sensation to the emotional center, means buddhi. In buddhi, there is an analyzation of that sensation, and then it take away to the sensory associate part where we got the sukha, dvesha, कि वो अच्छा है बुरा है. That analyzation is happened, and then from the motor sensor, motor associate area, it again passes to the indriya, that yes, this is good, this is bad. That is called jnanam. So these are the guna of atma guna. These are the atma guna. Okay, so all jnanendriya means all jnanendriya pathway, all jnanendriya pathway, indriya pathway, the sensational pathway, Ayurveda has described in Atmaj Guna. Eye coordination pathway, nasal pathway, taste buds pathway, skin pathway, all Indriya pathway as explained by Atmaj Guna. Okay. Am I visible to everyone? So when we're talking about the guna, so guna are the inherent qualities of the substances derived from the Panchamahabhuta, five elements. Traditionally, 20 pairs of opposite qualities like guru, laghu, snigdha, ruksha, sheeta, ushna. These are the guna. Okay. So when we talk about the guruvadi guna, like guru guna, guru guna also having a quality of kapha dosha. Kapha dosha also has a quality of guruta. So suppose a gurutva, jadatva, मतलब गर्म पानी देना, गुरुत्व जड़त्व is created by guru guna of a kapha dosha, having creating mandatva, achalatva, swelling, shotha, inability to walk, swelling on face, heaviness, medo rog. These are the symptoms created from the gurutva. So when we're treating the gurutva, which kind of dravya we should use for treating the gurutva? Hmm? Which kind of dravya we need to for treating the gurutva? Laghavatva. जब हम मेदो रोग को ट्रीट करते हैं, तो मेदो रोग को जब हम ट्रीट करते हैं, तो मेदो रोग को ट्रीट करने के टाइम वी नीड द द्रव्य विच आर उष्ण, तीक्ष्ण, okay, but they are light in nature, they are लाघवत्व, they are लघु. okay, तो इसमें दो प्रकार है कि एक तो है उष्ण और तीक्ष्ण द्रव्य यूज करे विथ लघुत्व, और एक जो है वो स्निग्ध और लघु द्रव्य हमें यूज करना है. वन इज स्निग्ध एंड लघुत्व द्रव्य, हल्का सा स्निग्ध हो, लघु भी हो. ऑन वन इज वी कैन यूज उष्ण, तीक्ष्ण एंड लघुत्व. ओके, या लघु, रुक्ष, उष्ण, तीक्ष्ण. लघु, रुक्ष, one type is लघु, रुक्ष, उष्ण, तीक्ष्ण, and one is लघु, स्निग्ध, उष्ण, तीक्ष्ण. लघु, स्निग्ध, उष्ण, तीक्ष्ण, in this way. Okay, so the if a sheeta guna, sheeta guna, so the what are the qualities of a sheeta guna? What will happen if the sheeta guna is, it will be, is there sheeta guna? Yeah, तो शीत गुना से पहले बात करते कौन से आहारों में, इन विच आहार यू फाइंड द गुरु गुना, इन विच आहार यू विल फाइंड द गुरु गुना. In which ahar you will find the guru guna? I have talked about the kapha dosha. Kapha dosha we found the guru guna. So in which ahar do you find the guru guna? Yes. Milk. Milk is a guru. Yes, madhur rasatmak ahar, snigdha ahar. Meat. Meat we found in meat, milk. Yes, madhur ahar, madhur amla ahar. Every madhur rasatmak ahar, every. Okay, so we will found this guru guna, which is useful in emaciation. So if you use the laghu ahar in that, we are giving guru ahar, increasing gurutva, increasing weight, increasing fat. Okay, so guru ahar, increasing heaviness, increasing fat, increasing weight, bharatva. So exactly opposite the laghu guna ahar. Which type of ahar is laghu? Which type of ahar is laghu? In which ahar we will found the laghutva? We found in pulses, moong dal. We found in phala ahar. We found in moog, lahi. We found in chaj, buttermilk, which are responsible to reduces the kapha and helpful in obesity. Okay, पृथ्वी पृथ्वी और जल महाभूत के आधिक्य वाले द्रव्य तो गुरु गुणात्मक है. सो लघु गुणात्मक आहार किस में पाए जाते हैं? मूंग दाल, मूंग में फल है, फल, मूंग एंड लिक्विड डाइट. ओके, तो व्हेन वी टॉकिंग अबाउट द शीतत्व, शीतत्व, शीत गुना, coldness. So when shitatva is happen, which dosha will prominently get triggered by shita guna? Which dosha will prominently get triggered by shita guna? Now this shita guna containing snigdatva, wet shita, vata and kapha. Okay, so when we're talking about the shita guna, we're talking about the weight shita guna, so most probably kapha dosha. Okay, and along with, okay, so where do you use this shita guna for treatment? Now there is an opposite question. Where do you use this shita guna for treatment? For which dosha? Where do you use this shita guna for treatment on which dosha prakopa? Pitta, right. Which? Pitta dosha. Pitta dosha. Now, which type of disorders of pitta dosha? Which type of dosha of pitta dosha? Which type of roga pitta? Like bleeding piles, dah, bleeding piles, bleeding, like atyartava, like रक्तजर्श, रक्तजातिसार, दाह, right? Bleeding disorders. We can use sheeta guna. We can use sheeta guna, right? Am I right? Right. Now there is a completely opposite ushna guna. Now again, listen carefully. The ushna guna will trigger which dosha? ushna guna will trigger which dosha? What happen if we give ushna gunatmak dravya to any person? Which dosha will get trigger? Which dosha will get affect by giving ushna gunatmak, like a black pepper, like a pimpli? Which dosha will get affected by giving ushna gunatmak dravya? First, kapha dosha get decreases, kapha dosha gets emulsify, and pitta dosha get increases. So when we using the trikotu churna, when we using the trikotu churna, which are tishna, ushna, gunatmaka, it will helpful for increase kapha dosha to decreases, and it will helpful to increase the pitta dosha. And one more thing, and also for vata dosha, and also for vata dosha, in which vata dosha, where stiffness, stabdatva, amatva is increases, and because of the stiffness, amatva, stabdatva, the vata vyadhi is increased, where it is also helpful to decrease the vata, pacifies the vata. So it will useful for two dosha, for vata and for kapha. For vata and for kapha, and it is also useful in pitta, mostly pachak pitta, for digestion. For digestion. One trikatu churna is helpful to decrease the vata, to decrease the kapha, and to used in indigestion for pachak pitta, and to increase the pitta. Yes, understand? समझ में आया? So guna with clinical signs, like we will go again, ruksha guna. So what type of, no, ruksha guna is a guna of vata, but when we're talking about the ruksha guna, when we're talking about the ruksha guna, so what type of symptoms is occurs by ruksha guna on the body? What will occurs when we talking about the ruksha? रुक्ष गुणों की क्वालिटी क्या है? क्या कहते हैं हम? रुक्ष माने क्या? ड्राइनेस, जैसे कि जब हम गुरु गुण के बारे में बोलते हैं तो गुरु मीन्स ब्रूहनम. गुरु मीन्स ब्रूहनम. गुरु मीन्स by bruhanam the body, by bruhanam the shariram, it will increase the weight. When we're talking about the laghutva, laghu, langhanam the laghu. Langhanam means laghavatva, means lightness, means langhanam, means upavasam. So exactly when we talking about the gurutva, it bruhanam, it increases with madhur and prithvi and Panchamahabhuta. When we're talking about the laghutva is occurring, the increasing the agni by tikshnatva, by ushnatva. Laghavatva is increasing the Jatragni. Langhanatva is increasing the Jatharagni. When we're talking about the Sheetatva, Sheeta is creating the stiffness, is creating the Stambhatva, Stambanam Himaha. Sheetatva, Stambhanam Himaha. So that's why to Stambhana, we need Sheeta Guna for bleeding disorders. For bleeding disorder, we need Sheeta Guna. So when we talking about the Rukshatva, again यार वही प्रॉब्लम हो रहा है लाइट का. When we're talking about the snigdhatva, sorry, rukshatva. So what type of work rukshatva will do? Dryness, but by how dryness is work? How dryness will work? Dryness कैसे काम करेगा? No, not लेखना. रुक्ष हो गया मतलब उसका पानी जो है वो सूख गया. तो कैसे कहेंगे? शोषणम. शोषणम. रुक्ष शोषणे शक्ति ही रुक्षः. शोषणे रुक्षः. Absorption, more absorption of Jala Mahabhuta. More absorption of Jala Mahabhuta. हाँ, आम का शोषण, जल का शोषण. आम का पाचन, जल का शोषण. Now, vidagda means jalana and daha means ushma. Vidagda means we are burning something. Or daha, it going to burn. If you still persist the dahatva. Ushma. Feeling of ushma and burning of ushma and burning the skin, both are the two different things for Panchamahabhuta. Okay, so shoshanam. So to remove that ruksha guna, what should we have guna? कौन सा गुण चाहिए? कौन सा गुण चाहिए हमें? Now, because of rukshatva, we have a dry skin, dryness of mouth, dryness of intestine. If the intestine become dry, what will happen? If the intestine become dry, what will happen? If the mala become a dry, what will happen? Malavastamba, absolutely right. Malavastamba. Right? In which disease we found the Malavastamba? In which disease we found the Malavastamba? We found Ama Avastha. We found in Ama Avastha. In Arsha Avastha, Ama Avastha, Udavarta Avastha, Grahani Avastha, Jwara Avastha. Every Vata Avastha we found Ama Avastha, where Rukshatva is increases, dryness is increases. So what will we prescribe for dryness? We tell to patient to take ghee, snigdha dravya ghee, snigdhatva ghee. We advise snigdha dravya like ghee to patient. We advise to take apanakala ghee, ghrutam, right? Apankala ghee. But if the patient having a jwara, amatva, so by giving snigdhatva, we understand that the arm will increase. So we giving the trikatu churna along with the ghee. Here ushna and snigdhatva both are coming together. Are you getting? So vata, when vata dry up, there is a rukshatva on a skin, dryness of skin. Okay, and when agni is dry, there is a daha. Vata don't have a dahata. Agni has a dahata. Burning soul, burning pada, burning the hand, soul. All these things get burned. We will found the soul become a very cracky soul. Hmm? The cracky soul. Again, where you have to pour the soul, you have to लेपम of a snigdha घी से उसको लेपनम करना पड़ता है. We need to give. Okay. So do you understand? So what will be the sneha guna? What will be the sneha guna will work on cracky souls. By increase of a pitta guna of agni, by increase the dahatva at the soul in a hyperthyroidism patient. In a hyperthyroidism patient, continuously having a cracky soul, continuously having a highly sweatings. So in this case of hyperthyroidism, what work will, in hyperthyroidism there is a rukshatva in eyes, in hyperthyroidism there is a rukshatva in intestine, in hyperthyroidism there is a rukshatva in a tvacha, in hyperthyroidism there is a dahatva in a soul, dahatva in a soul. In hypothyroidism, there is a vata and pitta, both dosha are pradhana. So, what exactly the snigdha guna will work? Mardhavatva, mrudutva, softness. When we giving the ghee in vata pitta dosha pradhana disease like hyperthyroidism, the ghee will work as a bala, as a varna, as a pitta as a, to decrease the pitta and vata. And this ghee, when we applying to soul, it increase the mrudutva, mardhavatva. This ghee will improve the hair, tvacha, nails, and eyes. This ghee in a hyperthyroidism, because of vata and pitta dosha, dahatva and rukshatva, sandhi shulam, the crackling sounds is occurs, cracking sound is occurs. So this snigdha guna will increase the flexibility, elasticity, and provide the good mobility by snigdha guna. Okay, understand? So snigdha guna is very, very important in dermatology cases. Every dermatological cases, even if it is a kushta, psoriasis, xerosis, eczema, where there is a dryness, there is a dahatva, there is a increase of kapha dosha leading to kandutva. We need snigdha gunatmak lepam to remove the rukshatva and to increase the mardavatva, to increase the mrudutva, to increase the snigdhatva by snigdha gunatmak dravya. Now, sheeta guna occur in which diseases? In every inflammatory disease. In every inflammatory diseases. Inflammation. Every inflammatory disease. There is an inflammation in intestine. There is an inflammation in muscle. Inflammation in rasadhatu. Shotha in every inflammation. Which guna is increases in inflammation? Which guna is increases in inflammation? What happened in a shotha? What happened in a shotha? Guru, kapha dosha, and sheeta guna. Sheeta guna, not ushna guna. For inflammation, we give hot fermentation or sheet fermentation. For inflammation, we give hot fermentation or a heat or a sheet fermentation. We give ushma fermentation. So the critical condition like a jwara, like a shotha, or we can call a fever or inflammatory disease, every inflammation is under cover of itis, appendicitis, colitis, duodenitis, gastritis, esophagitis, glossitis. Every inflammation is because of kapha and slightly pitta and vata dosha. There is a tridoshatmak, but more prominent kapha, less prominent pitta, and more less prominent vata. There may be differences. Kapha, vata, pitta, kapha, pitta, vata. When there is a kapha, pitta, there is a swelling and dahatva. When there is a kapha, vata, there is a swelling and shula. So we need to understand which type of fermentation we need. When there is a kapha, pitta, there is a redness of swelling. There is a swelling, but there is a complete redness. That is paka avastha. There is a secondary stage, paka avastha. Dhatu paka avastha. Now in dhatu paka avastha, where there is a kapha and pitta and little bit vata, so which type of fermentation we need? Here we need a ushna fermentation. Which type of lepa we going to use? We're going to use sheeta, where there is a paka avastha. पर always when patient is coming with हमारे पास जब भी पेशेंट जब आता है तो it always in a कफ वात अवस्था. There is a swelling. Now, in case of appendicitis, the acute appendicitis always with vata, always with the kapha and vata. Slightly pain, McBurney point pain, okay, kapha vata avastha, okay. But when that stages goes to the chronic appendicitis, the stages changes to kapha pitta avastha. Kapha pitta avastha, where pitta tikshnatva is increases, patient having vomiting, patient having fever because of dahatva. Okay, are you understanding? Are you understanding the guna of ushna and tikshna and ruksha and snigdha? Now, if you talk about the mandaguna, if you talk about the mandaguna, what we understand by mandaguna? In which disease we found the mandaguna? By mandaguna, which dosha get affected and how it affected? Mandaguna. All activity get decreases. All body physical activity get down. All physical activity get decreases. Okay, all physical activity get decreases by mandaguna. Hmm? By mandaguna, all dhatu activity get decreases. All dhatu poshana get decreases. By mandaguna, all is physical activity, movement get decreases. It become alas, laziness, alasya, gauravatva, susti. These all happen because of mandaguna. By mandaguna, his activity gets shamanam. His shakti gets shamanam. Directly sperm motility get decreases. Yeah. Dhatu shaya. Can I from rasa to shukra, every dhatu get affected. Rasa to shukra, every dhatu get activated. Okay. So we can talk like shamanam mandaha. शमनम मंदाहा, जो गुणों के जो द्रव्यों के कर्मों को शमन करता है, दैट इज मंद गुना. The manda guna is a manda guna is of a kapha dosha. Kapha dosha is increases in manda guna. And which ahara dravya is helpful to increase the manda guna? Again, kafaruddhi ahara. Kafaruddhi ahara, like milk, madhur rasa, all dravya are helpful to. So exactly opposite, hypothyroidism, where vata kapha dosha is increases, where manda guna is increases. Prameha, PCOD, where manda guna is increases. Agni mandya, dhatu shaya, rajayashma, pakshaghata, every shayatmak vyadhi is under the agni mandya. Agni mandya because of shaya, or shaya because of agni mandya leading to pakshaghata or anything, is mandaguna, mandagni. So to remove the mandagni, what kind of agni we need? We need मंदाग्नि को कम करना रहेगा तो कौन सा अग्नि चाहिए? मंदाग्नि को कम करना है तो कौन सा अग्नि चाहिए? तीक्ष्ण अग्नि. कौन सा अग्नि चाहिए? तीक्ष्ण अग्नि. To remove the kapha, we need a pitta, we need a ushna. So tikshna guna, we need tikshna guna. लेकिन तीक्ष्ण गुण का जो कैरेक्टरिस्टिक्स है वो क्या करता है? मंद गुना, because of excessive kleda in ashaya, that ashaya is lepam with the ashaya is lepam with the kleda, and because of that, that ashaya become a manda agni. The agni which is coming from the interstitial wall of the ashaya, where the kleda get deposited, so the agni cannot come, or the gastric juices get blocked. Gastric juices get blocked by the kleda, excessive kleda deposition. Because of that, agni unable to come to the ashaya and to pachana the dravya. So when we using the tikshna gunatmak ahara, like a maricha, like a trikatu, so what exactly trikatu churna will do in ashaya? Will it remove the kleda? Will it clean the kleda? Will it clean the ashaya? Yes or no? Tikshna guna is shodhanam shakti tikshnaha. Shodhanam shakti tikshnaha. Right? Shodhanam shakti tikshnaha. It will clean the ashaya. It will remove the kleda, open the channel of gastric juices, and sometimes it will digest the kledaha. It not only shodhana, it will bhedana also. It will bhedana also. Tikshna guna is a useful for shodhana and for bhedana. For lekhana we use kharaguna. Tikshna guna having a warmness. Warmness. Kleda is like a butter. When warmness come into the ashaya, kleda emulsify. वो पिघल जाता है, उसका द्रवत्व होता है, वो पिघल जाता है, वो ब्लॉक को निकाल देता है. और कभी कभी अगर वो दही जैसा ब्लॉक रहेगा तो उसको वो टुकड़ा कर देता है और उसका पानी कर देता है. Just feel like a kleda is like a butter. That butter is all over the ashaya, all over your wall of the house, all over the wall of the house. And when you are starting the heater, when you are starting the heater in a high power, you feel the warmness, you feel the sweating, you feel the palpitation, you feel all over the wall getting emulsify. वो पूरा जो घी है, जो क्लेद है, वो पिघल रहा है. And because of that, the channel which are get blocked by the manda guna is get open. In this way, tikshna guna work. So you cannot give tikshna gunatmak dravya for longer time, because it will also affect the heart and kidney and brain. Because heart, kidney and brain are also covered with the fats, with the good fats, with the medaguna, with the snigdhatva. That's why for a very short time period, we need to use the Tishna Gunatmak Dravya to remove the Mandaguna. Are you getting? So in Vata Vyadhi, when we removing the Mandaguna, we use Lasuna. In a Kapha dosha, we remove the Mandaguna, we use Trikatu. Okay, understand or not? समझ में आ रहा है कि नहीं आ रहा है? So today we will stop here. Next guna we will discuss in the next lecture. Okay, so think in that manner. You will understand if you think in that manner. Ruksha guna, what type of ahara increase the ruksha guna? We tell the patient to tell that this type of ahara should avoid it, like rukshahar means pulses like chana dal, harbara. This type of pulses is we tell to avoid. Okay, thank you very much.